IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hi and welcome to another episode of All Things Policy. This is Nankani. I'm an assistant program manager with the Takshashila Institution. In this episode, I have with me Harshit Kukreja, who currently works with the Health and Life Sciences vertical at Takshashila. So as all of you would know that NFHS 5 data was recently released. So in this episode, we are going to talk about how almost half of the Indian population do not seek public health care from government facilities in India. Do we really want people to go about using public health facilities in India, and how we can overall improve the health outcomes of the larger population? So, Harshit, how are you?
Hey, Mahek, I'm good. How are you?
I have been good. So, Harshit, before getting into the NFHS 5 data, I would like you to tell our audience about how actually government health facilities function in India, the three-tier healthcare system we have, and what have been the major milestones since independence.
Yeah. So basically, we have a three-tier sort of a referral system in which there's a primary level, a secondary level, and a tertiary level. At the primary level, there are sub-centers and primary healthcare sectors, the PHCs. A sub-center is basically, there should be a sub-center to serve a population of 5,000 people. And the standards are less for tribal areas or hilly areas. Around, for a population of 30,000 people, there should be one primary healthcare center. They usually take care of minor issues, follow-up, and whatever cases or whatever health conditions they cannot deal with, they refer to the second tier. That is the community health centers. Yeah, and smaller like sub-district hospitals. So the first tier is sub-centers and primary health centers. Second tier or second level is community health centers and smaller district hospitals. So whatever smaller district hospitals or community health centers cannot deal with, they refer to larger district hospitals, and medical colleges and research institutions. So it's a referral system in which minor cases or comparatively minor cases or cases which do not require a lot of expertise or routine sort of like follow-up and immunizations and nutrition is dealt with at the first level. Whatever the first level cannot deal with, it refers to the second level. And whatever the second level cannot deal with, refers to the third level. So regarding milestones, we have made a lot of improvement in our systems. We obviously still lag a lot, but we have made a lot of improvement in our system. Right now, we have somewhere around 30 to 35,000 PHCs. We have a lot of CHCs. We also have like a good district hospital in a lot of districts. We also now have some initiatives like the Mohalla clinics in Delhi, which are trying to tackle primary healthcare. We also have the union government trying to provide health cover to the vulnerable. We do have a lot of good initiatives, but we are still lacking and we do need to improve. And we are especially lacking at places which we shouldn't. We are lacking in tribal areas. We are lacking in remote areas. We are lacking health facilities for the urban poor. We are lacking health facilities for the migrants. These are the people which are more at risk and are more vulnerable. So, yeah, we have made progress, but we are still lagging a lot.
Yeah, correct. You're right. Like over the decades, of course, India's government healthcare facilities have increased. We have had PHCs, CSCs. Now we also have health and wellness centers. And of course, we have served millions of people. And now we are heading towards our end goal of health for all. But having said that, we know that the recently released data by fifth round of National Family Health Survey, it revealed that half of the families in India do not usually seek healthcare from public health facilities. And of course, this number is lower than the 55% of NFHS 4, which was for 2015 and 16. And this holds true both for rural areas and urban areas. For example, in rural areas, 51% of households usually choose public health facilities over private ones, and in urban areas, mainly 46.1% of of the households use public health facilities in India. And this is despite the fact that care at private health centers are expensive, which is almost 4 to 10 times as much as treatment at a government health facilities. And we know these are not accessible for mostly low and middle income groups. So, Harshit, what I want to bring about, or what I want to ask you is, what do you think are the major reasons that people are choosing private health facilities over public health facilities in India?
Yeah, so obviously there are a lot of reasons. There is this perception, and there's also this is a reality also, like a lot of times that the standard of care provided at public or government health facilities is not that good. So people avoid government health facilities because they are not able to get the correct treatment for their illness. The report says that a lot of people are also avoiding public healthcare facilities because they are too far. They have to travel a lot, and it is not possible for everyone, especially the people from the low income group, to spend a lot of money in traveling and also to spend a lot of time and not work for that particular day. So they're very far. The report also says that, so obviously there are a lot of reasons, but I think I'll first talk about what the report says. So there's also the thing about timings. Usually government facilities have a lot restrictive timings as compared to private facilities. Government facilities only have morning OPTs, functioning morning OPTs, and that too you have to wait for a long time. And it may be that you don't get a chance to see a doctor or a healthcare provider that day. There's also a thing about missing staff. A lot of tier one infrastructure and maybe a lot of tier two infrastructure has a lot of missing staff. Either staff has not been hired or they're not present. So people don't know if they go to a far away PHC, will they be, or a CHC, or will they be able to get the treatment? And will they be able to see the doctor or the healthcare provider, which will be able to provide them the treatment? And there's also a play of perception. So even though the standard of care, maybe if you compare a big district hospital to a private hospital, is same for a lot of diseases, the treatment provided is same, the drugs provided is same, but the perception that the private hospital creates as opposed to a government hospital is very different. So when you enter a private hospital, it's clean, the staff is more receptive, the doctor spends more time with you and is able to provide you more counseling because obviously the private hospital has a less load and the staff has a lot more time to spend per patient, but they're able to counsel the patient well. They're able to explain the disease condition to the patient well. So it's also a play of perception. So even though the outcomes may not vary a lot for the tier three for a lot of diseases, but there's a perception that private hospitals are way better. They're obviously way better, even if you can compare. For instance, if you take something as specialized as organ donation, is done at least in North. There's a hub at Chennai. There's a hospital at Chennai which does a lot of organizations. For instance, in Delhi, Max Saket does a lot of. This is a private hospital, private super specialty hospital. It does a lot of more donations and more type of donations than even AIMS does. So the best public hospital in Delhi does not do certain procedures in the country that the private hospitals are doing and are willing to.
Yeah, Harshit, as you correctly pointed out, towards a very important point is that there is an ease of access for the people. And for example, the country now has almost twice as private hospitals than public ones. And of course, people can easily access to private health facilities, which is very true for hilly regions or regions with poor geographical locations because there are poor road infrastructure, there are poor transport facilities. So people can't even travel longer distances to access public health facilities. And of course, there are single doctor clinics, there are dispensaries in these regions, which holds true for states like Mizoram, Uttarakhand, Sikkim. And people, of course, tend to use private health facilities over public health ones. But however, we know that in some states, the use of public health hospitals or any kind of facilities has increased over the past 5 6 years. But for example, in Delhi, for instance, in Delhi, we know that the initiative of mohalla clinics can have a huge role to play in this, because people now have public health facilities in their proximity. So of course, the quality at mohalla clinics has also been indicated to be well than most government health facilities in the country. So I think that is one of the reasons that in some regions there has been an increase, but I really think that there are no particular reasons which can be indicated for other states. Like, we don't know why some regions are performing better than the other ones. What do you think about it?
There is obviously historical reason, but if you look at NFHS 4 and NFHS 5 data, except for a few states, you cannot talk about particular reasons for particular indicators improving. But if we say that people are now using more health facilities in Chhattisgarh, and because they now say that doctors are available, we were not able to, at least I was not able to find a particular reason as to why people are saying doctors are more available. So either it's because there was some kind of a sampling bias at some level at some states, or because this was maybe a soft push which has been going from a long time. But we were not able to find out at what particular indicator was improving because of what particular policy measure. At least for all the states. We were able to find out it for some states, but not for all the states. And yeah, and because of COVID, the data is a little askew. The parameters are a little up and down. But even if you like accommodate for that, and even if you like do not, if even if you take that into consideration, there is no single policy. At a lot of places, at a lot of states, there is no one single policy measure you can say is responsible for one of the improvement or depreciation in one of the indicators.
So, Harshit, for the past 10 15 minutes, we've been talking about how people in India are not accessing public health facilities for a variety of reasons. There's a lack of access, there are distance issues, there are timing issues, there are, of course, lack of health personnel. We don't have enough doctors and nurses at government health facilities. And of course, because the infrastructure is low in number, we have long waiting queues. However, being said all of this, my question to you is, do we really want to push people towards using public health facilities completely? Is that our end goal?
Yes, sir. This is a very interesting and important question. So we do not want we do not want to increase. Our only goal is not to increase usage of government facilities. We want people to have access to quality and safe healthcare. So that could be government, that could be private. So our end goal is not that the government is providing, at this stage at least, the government is providing sort of like free healthcare to everybody. Our end goal is healthcare is accessible to everybody at an affordable price, and the quality is up to mark. So end goal should not be, and is not that the government is providing. So but our end goal should be that the government is providing like subsidized or cheap and quality healthcare to the poor people, to people at the margins, to the vulnerable population, to the people who are just one hospital admission away from bankruptcy, who have to take debt to get treatment. So, and people, obviously, people who suffer from rare diseases and cost of treatment is high. So, our goal should be, as a country, we should focus more on these people and less on increasing access to government facilities for everyone. So, what
So,
do you make? What do you think about this? Do you think our goal should be to increase participation in government machinery, or our goal should be like increasing health?
see, I think our end goal should be improving the health outcomes of the larger population, giving them safer, quality, and affordable access to healthcare. My only question is, and my only point of contention is that will public health, for example, I think public health facilities can play a huge role in that, because I'm not sure how far is it possible for private healthcare facilities to provide affordable healthcare, especially to people who are at higher risk and are do not belong to a proper to a said economic status. So I think we can push people towards public health facilities because of the affordable aspect, because I'm not sure if private health facilities can fulfill that.
Like, I think you are a little, yeah, I think you're wrong in this because if you see healthcare as a market, however skewed it is, if you see healthcare as a market, the more we remove the barriers for entry, the more we relax regulations. For instance, I was looking at there's a Clinical Establishment Act. So it is like used in some states, it is not used in all the states. So it lays down minimum standards if you want to operate a clinic. So it says that if you want to operate a clinic and you have a doctor's consultation you should have a minimum number of one chair for the doctor and two chairs for the patient. But for the patient. And it has all of these kind of ridiculous regulations and all of these add to a lot of cost and all of these add to a lot of like input cost for the private player. Why? So, for instance, if we talk about this chair regulation, why does a doctor, a general physician, need to have a consultation room with a chair, a specified number of chair, a table, and two chair, and maybe an examination table? What if we have private clinics operating from maybe the back of a van? Obviously registered, you have to look at things like degrees and registrations and are they giving safe treatment, but you don't have to force private players to have a certain number of space or have certain number of
I
chairs.
correctly get that. I correctly get your point of having relaxed regulations for private health facilities to function freely in the market space. I am just arguing over the point of the intention of providing affordable healthcare facilities. And I agree that India, or for example, any country, for that matter, any country in the world cannot function without private hospitals coming in. My point is that we know that a huge population of India lives in poverty. And of course, like they recently released World Bank data by the Pew Research Center estimated that the number of poor people in India over the past 2 years because of the pandemic have more than doubled. And it's from 60 million to 134 million people. So, in order to improve their health outcomes, I'm really not sure private health facilities playing a huge important role in it.
So the government cannot like provide. We do not have the state capacity, and we also do not want the inefficient. We want the government to regulate the healthcare sector to an extent that there is no harm caused to the patient and market failures like information gap is removed. But I don't think government is the best provider of any kind of services. This also holds true in healthcare. Look at how inefficient government hospitals are. Look at how private hospitals have better outcomes. Look at how all the cutting edge technology and all the cutting edge procedures and treatments are done in government hospital. Look at how you can get a hold of your consultant at maybe 2 in the morning if you are admitted in a private hospital, and you cannot like reach your consultant after like he completes the rounds when you're in the hospital, in a government hospital. So, first of all, we cannot provide at the current stage. And second of all, I don't think we should like, we should be aiming at complete 100% public funded,
Yeah, correct.
public
Can't.
hospital.
We
Yeah.
can't. I completely agree with you on that. We can't really have just public health facilities functioning in the market when, of course, we know that the quality of care that private health facilities are providing and are bringing in new technology. At this moment, the state capacity is not that. I was just hinting towards improving the state capacity and improving the kind of human resources, personal and infrastructure that we have at the moment so that we make it more easier and more affordable for people to access.
So, yeah, obviously improving present facilities is a very important step. We also want to, so there are a lot of vacancies. If you like open a newspaper, I think it was just last week or I don't remember exactly, it was last month. A lot of state government health missions were had a lot of vacancies. And for instance, I think the total number of vacancies allotted were 10,000. And I don't think they were able to fill more than 5 or 6,000. So filling vacancies is a very important step. And filling vacancies and thereby improving the private healthcare infrastructure is a very important step in this.
Harshit, now we've spoken about, of course, that both private and public health facilities have to function at their fullest capacities to provide good healthcare services for a population as large as India. Do you have any further suggestions on how we can improve the overall health outcomes of the larger population in India? Like, how do we fill in the vacancies? How do we improve the medical education? We know that we still don't need the WHO prescribed standards. How do we regulate the pharmaceutical industry in the country? Do you have any suggestions on that?
Yeah, so I think most of my suggestions, at least concerning the healthcare sector, are ease the restrictions, only keep the same ones. For instance, it takes a lot of capital, political as well as cash to set up a medical or a paramedical college. And they all have all kinds of ridiculous restrictions on and regulations on how you can set it up, the number of examination halls you should have, and all these things they add to the cost of setting up and running a hospital. And also, the government at any place, at any pace, cannot fulfill the number of seats we require. For instance, for doctors, the seats we require to be a good functioning society, the number of doctors we require, we have to open up more to private colleges and let them function. And, do not have things like ceilings on fees and everything else. Because as long as the market is free, obviously the market cannot be 100% free if there's an external payer and if the government is providing subsidized education. The price will obviously come down, the fees will come down. But you cannot have private people come in and when they set up, you say that, oh, so you cannot charge more than X amount of fees. That is counterproductive and that will not prove to be an incentive for private players to come in. For pharmaceutical industry, we do have a large manufacturing base and we should take advantage of it. There are certain concerns about certain aspects of our pharmaceutical industry with in regards to regulation quality, but those can be addressed because we are already meeting, even for generic medicines, we are already meeting certain standards. The same factories which are making subpar medicines are making quality medicine, quality generic medicines for export. So it can be done. And just because there's no incentive and just because the government is concentrating at wrong places, concentrating on wrong regulations, we are not able to get a lot of good quality pharmaceuticals and devices. And yeah. So one thing more what we have to look at, we also have to look at, I think if you remember our conversation from last month, we were talking about romanticization of health. We were, you
Yeah.
know, yeah. So NHS, that is National Health Service for UK, it says that it has a threshold which says that if a treatment costs more than 30,000 euros, 30,000 pounds, sorry, 30,000 pounds, and adds less than 1 year of life to the patient, the government is less likely to pay for it. So they have put a value to 1 year of healthy life. This is done by a lot of governments, and this is what we also need to do. We however crude it may sound, however cruel it may sound, but we do have to assign a monetary and resource value to life. Only then will we be able to allocate our resources efficiently and look at better health outcomes.
Thanks, Harshit. You made a lot of sense by highlighting how we need to optimize and take advantage to the capacity and capabilities of our large pharmaceutical industry and also about romanticization of health. Over the past few years, we have been doing a lot of it and we really need to get away from it. Otherwise, we won't be able to provide quality health at affordable rates for all. Thanks, Harshit, for being here. I hope you had a good time at the podcast.
Yeah. So health I can talk about any time of the day, and it's always a fun conversation with you. Yeah. Thank you so much for having me, Mahek. Hope we have more such conversations.
I'm sure of that. Thanks for doing this for us. And listeners, for more such interesting episodes and point of views on public policies, health and technology, stay tuned to All Things Policy.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
There's a quick survey to fill out on ivmpodcast.com/survey. It lets us know a little bit more about who's listening to us. And you know what? We're going to do a few prizes. So, we'll do a random drawing of maybe 10 people and we'll send you all some swag. Remember, that's ivmpodcast.com/survey where you can fill out the survey.
Hey, it's been another great week on the IVM Podcasts Network. On The Habit Coach, Ashton delves into the power of meditation with spiritual guide Swami Purna Chaitanya. On Misconduct, Raghavi and Nisha tell us the story of Neha Verma, who killed 3 women in cold blood. On Cyrus Says Cock and Bull, Cyrus, Puneet, Utsav and Antariksh talk about the Tamil Nadu woman who disguised herself as a man for 36 years to avoid sexual harassment. On The Longest Constitution, Priya takes a look at the contest between private, commercial and constitutional interests. And on Big Talk About Tiny Humans, Devi Shobha and Meghna tell us how we can raise awareness about child sexual abuse. We've got some exciting news for you. IVM Podcasts has just launched its merch and our first line is out now. Head to the IVM Podcasts website and click on the shop tab to check out our first collection of t-shirts. Do follow us on social media. We are IVM Podcasts on Twitter, Facebook, Instagram and LinkedIn. And remember, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Don't forget to rate us on any platforms you're listening on. You can also check us out on YouTube. We are also doing a small listener survey to better understand how you respond to our shows and advertising on the network. We would really appreciate if you could spare a few minutes to fill it. It helps us build better shows for you. And finally, we would like to thank our sponsors this week: SBI Life Insurance, Jupiter, a digital banking app, and Capgemini. Get the future you want.